Good afternoon, everyone.
The broadcast is now starting.
All right.
Attendees are in listen-only mode.
So I know a couple of you local reporters have been texting me and that sort of thing. I'm sorry for the delay. I hope you can hear us well. If not, when we get to the Q&A portion, please let us know. We've had a little bit of trouble getting a microphone to connect with the laptop. It's not working as well. We are streaming this right now to Facebook and YouTube as well. So I apologize for the audio on the webinar. Hopefully we're projecting enough that you can hear us just fine. You can ask your questions and we'll get your questions answered. And of course, those feeds are going to YouTube as well, and we'll also make this video available soon after we do this press conference as well if you need a clean feed. So good afternoon, everybody. Thank you for joining us this hastily called press briefing this afternoon. We've had so many questions come into the Joint Information Center today that we really wanted to spend some time with our friends in the media, and certainly those of you who are joining us via Facebook or YouTube. And answer any questions you might have about Phase 1B. The plan, of course, continues to evolve every single day. We want to be upfront about that and let you know what we have in place and our partners that we're working with. And we have a lot to talk about that. So we also want to recognize that there's a lot going on in the world today, especially in Washington, D.C., where people have stormed the Capitol building, and our thoughts and prayers certainly go out to those folks in Washington, D.C., and to our leaders there who are doing their important work as far as approving the results of the election. And of course, the dispute over election results here in Arizona is not lost on us, as we were a part of that operation as well. So we want to make sure you know that is on our mind. Our thoughts are with everybody out there, as well as our leaders here locally in the state of Arizona. So with that, I'd like to introduce Dr. Rebecca Sonnenschein here in a second. She is our medical director at the Maricopa County Department of Public Health. She has been working with the team day and night for many months, planning for the pods, and now continuing to develop the plan and move with the flow of vaccine as we get more supply. How is that going to be distributed as we enter Phase 1B? So she'll talk a lot more about that. If you're struggling a little bit with the webinar, we've had some issues in the past where you can't raise your hand, you can't get our attention in that way to ask your questions. Please log out, log back on. We'll get to you, and we usually have time to get to second questions as well, sometimes even third questions, depending on how much conversation we have. So we appreciate your patience with us today as we started a little bit late, but because of that, let's get right to it, and I'll introduce Dr. Rebecca Sonnenschein.
Thank you, Fields. Good afternoon. Today, we want everyone to be aware that we will be starting Phase 1B beginning next week. First, we are so grateful to everyone who has supported the pods, and that includes all the nurses, the physicians, the pharmacists, the people directing traffic, IT, and especially our 1,800 volunteers who are our friends, our family, and our community members, and the National Guard, who have filled so many different roles to make these complex pods operational and effective. We've said all along that pods are only one piece of vaccine distribution. All of our plans have depended on how much vaccine we have at the time. So with our initial plans, we had no idea how much vaccine we would get, and these pods made the most sense to reach the most people quickly, particularly healthcare workers. Pods work for smaller, targeted groups like healthcare workers who come from a variety of settings, including hospitals and outpatient facilities. With Phase 1B starting, we're expanding to other groups now: law enforcement, teachers, child care workers, all school staff, and people aged 75 and over. As we've said, the more vaccine we have available and the more groups that are eligible, we will continue to expand to additional distribution sites. Now is that time. We can start to open up these sites on Monday, and you'll start to see specialized clinics for school staff and child care workers. You'll see pharmacies and federally qualified healthcare centers who have vaccine to offer for those individuals age 75 and over. So we're not just going to have pods, we're going to have other distribution sites available. And the more vaccine doses we get, the more sites we can allocate vaccine to and we can make available to the public. Registration information for appointments to get vaccine will start on the 11th. You can access all of this information on our website, and we will continue to update the website as more sites become available and we have more information to share with you. We know everyone is ready to move to the next step, and so are we. Please understand that we're trying to finalize all of these details as fast as we can to ensure a smooth experience for everyone who can get vaccine. Thank you.
Thank you so much, Dr. Sonnenschein. We'll go ahead and start our question and answer period. Please let us know if you're having trouble hearing us or anything like that. It's a little unclear to us how the audio may be functioning on the other end, but we want to make sure we get you the information you've asked for from the Joint Information Center today, and I appreciate Dr. Sonnenschein taking some time out of a very busy schedule to do this. So with that, Jennifer, do we have somebody on the line?
Yes, Peter Samore, and please unmute yourself. There you go.
Good. I'm glad I can hear you all just fine. Everything is working nicely. Thank you. So I want to be clear. Are all the pods open right now? I know there was talk of 5 of them countywide. I'm hearing reports of just 3. If so, why is that? And just to be clear, are the pods open to the public? Or are they just open to people who qualify or are eligible for at this time the vaccine? I'm saying 1A and 1B.
You know, Peter, we appreciate you asking that question because we have heard of some people going to the pods. I mean, obviously the locations are public. They're on our website. They are not open to the public right now. They are open to frontline healthcare workers who have already registered for appointments to get their first dose of vaccine. Starting next week, we'll also have frontline healthcare workers coming back to pods to get their second dose of vaccine, in addition to those that are still getting their first dose of vaccine. And that's part of what Dr. Sonnenschein wanted to line out today, that there will be many other pods or locations, but not the primary ones that we have had open to this point. And Dr. Sonnenschein can expand a little bit more on why some of them have been put on pause, and as staff and everything else has to be juggled around and making sure people get some time off during this process as well. They've been running very strong through the holidays. So Dr. Sonnenschein can expand on that a bit.
Thank you for the question. The pods are open today. Some have been paused in order to restock them to make sure that they have all of the supplies. The process is meant to keep the flow of vaccine going to healthcare workers smoothly, to make sure that we can get as many as possible their first dose, and we're beginning to start planning getting them their second dose as well. We want to make sure we use every single appointment that is available, which is why we're opening up into those 1B groups to make sure that any times that are open between the first dose and the second dose get filled with people who are eligible for vaccine.
And I should introduce Joanna Molina is with us here today. I failed to introduce her earlier. I apologize. And we're glad to have her back to translate these answers into Spanish.
La pregunta es que si todos los puntos de distribución están abiertos o algunos están cerrados y si ellos están abiertos al público. La respuesta es que no son abiertos al público en este momento. Es solamente para el personal médico que ha hecho citas para que reciba su primera dosis, y entrando la semana que entra empezarán con la segunda dosis también en los puntos de distribución para el personal médico. También cabe mencionar que los puntos de distribución solo son parte del rompecabezas. Habrá otros sitios que también estarán abiertos cuando empiece empiece la fase 1B, que empieza ya la semana que entra. Entonces, algunos de esos puntos también hoy están cerrados para poder reabastecer el equipo que necesitan para continuar con la vacunación. Por eso la fase 1B inicia también en estos puntos la semana que entra.
Thank you, Joanna. Thank you, Peter, for the questions. Jennifer, do we have somebody else?
Yes, Lily Altavina is next. Please unmute yourself.
Hi, folks. Thanks for having us today. My question is about how vaccines for school employees will work. I noticed you mentioned some specialized clinics, so if you can explain how those clinics will work, and will you also be going to schools and vaccinating employees as well?
Yeah, that's a very good question. We know there's a very large group in Phase 1B, our educators and support staff and that sort of thing. So Dr. Sonnenschein will take that question.
Thank you for that question. Our schools, including all of our school staff and child care workers, are a priority. We have already been in talks with our school superintendents and school partners and childcare partners, as well as pharmacies, to set up specialized clinics pairing a pharmacy with multiple districts so that they can set up their own school staff pods. And of course, that does include childcare workers. That way, people don't have to just go to these pods that we have established, but they'll have their own specific clinics that are scheduled at a time when is convenient for them so that they don't have to miss classes. Once we begin 1B, we're going to start to pair those pharmacies up with the districts, and it will take a while to get to all of the different districts, but that is our plan moving forward.
La pregunta es, ¿cómo funcionará la vacuna en las escuelas a partir de la fase 1B? ¿Irán las escuelas a los puntos de distribución o cómo será? Bueno, la realidad es que las escuelas y el personal, incluyendo también los de cuidado de niños dentro de las escuelas, ya hemos estado en comunicación con ellos, con los superintendentes y también con algunas farmacias. Esto para que ellos creen sus propias clínicas de vacunación especializadas en los horarios que sean convenientes para ellos, precisamente para evitar interrumpir los horarios de clase. Cabe mencionar que son parte de la fase 1B y estamos asociándonos con farmacias para que ellos puedan ir a las instituciones educativas y hacer esas clínicas de vacunación.
Thank you very much, Lily, for that question. Jennifer, do we have somebody else?
Yes, Allison Steinbaugh is next. You need to self-unmute, please.
Thanks so much for doing this. So I have a question specifically about registration. I'm wondering if you can elaborate on what that process will look like and what exactly people should know, as we get a ton of questions about that. And is that process online for everybody or just online for those who are over 75 and others are through school or workplace? And kind of another question, is there sort of a target number of people the county is hoping to vaccinate in 1B next week?
Next week, I think we should be very clear about the numbers of people in Phase 1B. I believe it's rough numbers, napkin math here, it's approximately 500,000 people. So we're certainly not going to get through that many people next week. But we can talk a little bit more perhaps about how the I'm sorry, Allison, you asked about how the registration process is going to work. It will be an online registration from what I understand. Now, which groups are in that? Dr. Sonnenschein can talk a little bit more about that. I do know also she mentioned working with these groups and these employers like school districts, and there will be other large employers as we work through the various phases. As their employees meet those phases, they'll be working through those as well, such as police departments and that kind of thing. And I guess you could I look at it as kind of a mini pod, if you will. So Dr. Sonnenschein can talk a little bit more about that. I'm sure she used far more technical terms than I do.
Thank you, Allison. So just as there will be many different opportunities to get vaccine throughout Phase 1B, there will be different ways to register. But all of that information can be found on our website, and it will tell different groups how they can register and get an appointment for vaccine. So that information will be on our website starting on Monday and will be constantly updated as more vaccine becomes available and we're able to open up new site availability. Additionally, you had asked about how many people in 1B we're going to get vaccinated next week. It's really important for you to know that we are still vaccinating individuals or healthcare workers in Phase 1A. We have given the majority of folks their first doses, but there are still people who have appointments to get their first doses, and we know that there are still more out there, and we have to get all of them their second doses. But again, it's really important that while these pods are open, that no appointment time goes unused, and that's why we're opening it up to these other groups in 1B. Cover it? Thank you.
La pregunta es, ¿cómo será el registro? Y en ese proceso, ¿será en línea? ¿Será para todos o para grupos específicos, para los que califiquen? ¿Y cuántas personas se piensa vacunar la semana que entra para que empiece la fase 1B? Bueno, cabe mencionar que son casi cerca de 500,000 de personas las que califican para la fase 1B y no se vacunarán en la semana que entra todo el grupo. Cabe mencionar también que hay diferentes maneras de registrarse. Esta información va a aparecer en nuestra página en español de Salud Pública del Condado Maricopa para los datos específicos de cómo puede registrarse, ya sea en línea o de alguna otra manera. También para la fase 1B, cabe mencionar que estamos ahorita en la fase 1A, todavía vacunando a personal médico que está lidiando con COVID-19 precisamente en las salas de emergencia. Ellos necesitan recibir la segunda dosis que empieza también la semana que entra. Entonces, los puntos de distribución de vacunación están sirviendo tanto la fase 1A como la fase 1B que inicia la semana que entra, para no desperdiciar ningún momento o ninguna cita.
Thank you very much, Allison, for the questions. And I hope we got them all answered. If we didn't, we'll come back around to you momentarily. Jennifer, do we have somebody else with a question?
Nicole Grigg is next. Please
Okay.
unmute yourself.
Hi guys, thanks for doing this, as it's easier to get answers this way than just to email. I'm just really curious and kind of following up on the registration that was just asked, where's the plan as far as, there's a lot of people who also don't understand the website, and you guys keep saying just check back on Monday. So what exactly is the plan for those people who do not navigate the internet? Will they be able to call and make an appointment? And I'm also curious why we're not starting registration sooner. We've seen other states, and within minutes these appointments get booked up. So I'm just curious why we're going to wait till Monday if we're going to start vaccinating those in 1B as well, and why we're not getting this into primary care physicians quicker, so it's not just these pods.
I think you ask a lot of good questions, and I think a lot of things, it's somewhat, we've talked about it a lot here when we're compared to other counties or other states. We're certainly not like any other county here in Arizona in that the sheer volume of people we have here. Of course, we're 5 times larger than Pima County, which is the next most populous county in Arizona. So a lot of answers come down to population and equity and being able to register the people who are truly in Phase 1A right now. And you all know that we haven't hit our goals in Phase 1A yet. And even despite the fact that we've had pods running a lot. So Dr. Sonnenschein can talk a little bit more about that and what the plan is and how people will be able to register.
We're very aware that not everyone is comfortable navigating the internet or speaks English as their first language. And we're working with all of our partners to make sure that there are multiple ways to register for an appointment, both online and to work with individuals who can help people navigate the appointment system. So we've simplified the process of getting appointments for the pods. The screening criteria are really just making sure that you do in fact fit into one of those groups. And we do ask that you bring proof of employment or your age with you to the pod so that people can verify that you're in one of those groups. You also asked why not post these appointments earlier. And the answer is we're not just going from 1A, vaccinating healthcare workers, to just vaccinating 1B. We're making a slow transition. The majority of appointments for Monday are already filled with healthcare workers. So what we're trying to do is open up to the priority groups in 1B as soon as we can, because we know people are anxious to get vaccinated, knowing that we're still vaccinating healthcare workers, but not wanting to waste a single opportunity. And your last question is why not give all of the vaccine to primary care providers? Well, the majority of the vaccine that we have is Pfizer, and you've heard lots about how it requires these very, very cold freezers in order to store them, that as soon as you get them out of those temperatures, you have a very short time to use them. It's a fragile vaccine, and that's why we developed with our healthcare partners these pod plans so we could bring thousands of people through where we can have freezers on site and we can have people utilizing these large amounts of vaccine quickly so that we can utilize all of it. The Moderna vaccine that we do have is being prioritized to long-term care facility staff and assisted living facilities, which are part of 1A, and they are some of our most vulnerable patients and some of our most vulnerable healthcare workers. As we get more Moderna vaccine, we absolutely want to allocate it to primary care providers. Right now, we want to make sure we get it to providers that can get it to as many people as possible, like federally qualified healthcare centers and pharmacies. Thank you.
Son varias preguntas. La primera es el registro. ¿Cuál es el plan? Siempre estamos mencionando que vayan a la página de Internet, que revisen la información el lunes, pero ¿cuál es el plan para personas que no pueden manejar el Internet, que no se sienten cómodos? ¿Y por qué esperar hasta el lunes en lugar de empezar el registro ahora? Y también por qué los doctores o las clínicas no tienen esas vacunas ahora. Bueno, son varias preguntas y vamos a tratar de contestarlas todas. Que no todos saben manejar el Internet, estamos de acuerdo, por eso estamos trabajando de la mano con socios para que ellos directamente puedan hacer las citas con las personas que no se sientan cómodas usando una página de Internet o que el inglés no sea su primer idioma. Eso estará precisamente más adelante programado para que la gente, los que califican en la fase 1B, puedan utilizarlo. También la mayoría de las citas no podemos empezarlas a hacer ahora porque esas ya están tomadas en los puntos de distribución con el personal médico que aún está recibiendo la vacuna en la fase 1A y continuará con la segunda vacuna también en esa fase. La mayoría de la vacuna que tenemos es de Pfizer, que requiere almacenarse de forma especializada. Por eso estamos utilizando los puntos de distribución, donde tenemos los congeladores específicos y no podemos desperdiciar la vacuna. La vacuna de Moderna es para personas de cuidados de centros de largo plazo, de cuidado a largo plazo, que lo estarán recibiendo. Como llegue más vacuna de Moderna, podemos ofrecer estas dosis también a las oficinas médicas para que puedan proveerla a los pacientes.
Thank you so much, Joanna, Dr. Sonnenschein, far more eloquent than me. So we appreciate that. Thank you, Nicole, for those questions. Jennifer, do we have somebody else with questions?
Yes, Matthew Casey is next.
Go ahead, Matthew.
Thanks. I appreciate you doing this. So for phase 1B, it's supposed to be expanded, right, to other essential workers who are yet to be determined. I'm wondering who's making those determinations and when that will be announced.
All right, so essential workers, we have been getting a lot of questions about who are essential workers in this phase 1B. Dr. Sonnenschein will take that.
So we are relying heavily on the CDC and the ACIP, which is the group that makes recommendations about who should be prioritized for COVID vaccine. So they are the ones who outline in general which people count as essential workers. And their recommendation is to start with what they call frontline essential workers. And what that means is those people who work for essential industries and organizations and government that are at the most risk. So in Maricopa County, we're working closely with all of our partners to make sure that we're working with them and that we're objectively looking at the risk of the people in the essential workers. And there's actually a validated tool where you can look up the occupations and determine what the risk of being exposed and what the risk of having a severe, and the risk of how many people you come into contact with. So combining those two basic infection control things, it determines your risk objectively. So we're using that to get the most at-risk people who work for essential organizations vaccinated first. They're going to be prioritized, and then we're going to continue to follow the state VAPAC guidelines, ACIP, and CDC as we get more vaccine to expand it to other essential workers per their recommendations.
La pregunta es, en la fase 1B se va a expandir a otros grupos y ¿quién toma esas decisiones a quién incluir en esas fases? Bueno, estamos trabajando muy de la mano con otras organizaciones, incluyendo con el Consejo, que da recomendaciones de los Centros de Control y Prevención de Enfermedades, y también el Estado, que decide quién es el trabajador esencial, que lo definen. Esas personas que están en más alto riesgo, que están en ocupaciones o trabajos que los desempeñan, que los ponen mucho más alto riesgo porque están rodeados de más personas. También el Estado y CDC también estarán añadiendo más personas o más grupos. A cómo se expanda, le estaremos dando a conocer esos datos.
Matt, thank you so much for the question. Jennifer, do we have somebody else?
Yes, Peter Seymour has a follow-up question.
Okay.
Hi there. So can you give us a quick update on how 1A distribution is already going in Maricopa County? Have more healthcare workers taken a little more kindly to taking the vaccine? And a follow-up to that, where are we on second dosages? I know that they went out starting today, as a matter of fact, at the state level. And then if teachers start getting their vaccines next week, is it still best for them to wait another 3 to 4 weeks to get the second vaccine before being a little more comfortable going to the classrooms? Or is it best for them to try to wait if they're already not back in classrooms?
Okay, that last part of your question, that's certainly a medical question, so I'll let Dr. Sonnenschein. We'll do our best to answer that one, I think. And so, yes, so let's talk a little bit about first doses versus second doses and how we're doing. I know that I saw on their dashboard we were over 62,000, I believe, and we have a lot more in the queue. So Dr. Sonnenschein will come up here and expand about that.
We have seen a lot of interest from our healthcare workers. In the very beginning, it started out a bit slowly, but as more and more people got vaccinated and did well, we saw a lot more interest. We vaccinated over 62,000 healthcare workers, and we have thousands more who have appointments that have already been scheduled. We have actually not yet started second doses. I know that you saw our state level individuals getting them. Those are also going to be coming up, and we wanted to make sure that while we're doing our second doses, we continue to be able to vaccinate those healthcare workers that haven't had a first dose yet, and any extra appointments go to people who are also eligible. And if I could ask you to repeat the second question, I'd appreciate it.
Right. So as teachers will be among Group 1B, is it enough for them to get the first dose and then maybe perhaps return to their classrooms if their districts are allowing so? Or is it best for them just to keep waiting at home if they're still at home so that they can get the second dose and then go back into the classroom if they feel safe to do so?
So what I can say is the ACIP and CDC recommends that you need 2 doses in the vaccine series in order to be fully immunized. I know that a lot of different experts and scientists are talking about how effective is 1 dose, but right now the recommendations are that you need 2 doses in order to be fully immunized. So we want everybody who's received any doses at all of vaccine or no doses to continue to wash their hands, stay home when they're sick, and not touch their face, because we don't want to completely rely on immunizations until we're at a point where we're seeing a lot less community spread and we've achieved herd immunity. Thank you.
Son varias preguntas. Estamos hablando de la fase 1A. Queremos una actualización de dónde estamos con la fase 1A y también para la segunda dosis. Y si los maestros que van a recibir ya la primera vacuna, la primera dosis la semana que entra, deberían esperar otras 3 semanas en sus casas antes de regresar a las aulas para sentirse seguros y recibir la segunda dosis. Bueno, empezamos por la primera pregunta. ¿Dónde estamos con la actualización de la primera dosis de la fase 1A? Al principio el proceso fue un poco lento, pero ya hemos otorgado más de 60,000 dosis a personal médico y miles de personal también sigue programado con sus citas precisamente para recibir la primera dosis. Aún entramos a la segunda dosis. Cabe mencionar que se recomienda que reciban las 2 dosis para que estén completamente protegidos. Hablando acerca de la segunda pregunta, los maestros que empezarán a recibir la vacuna la semana que entra y si deberían esperar 3 semanas en casa antes de regresar a las aulas. Bueno, la CDC recomienda que se utilicen las 2 dosis, que la persona se ponga 2 dosis de la vacuna para que reciba la máxima protección. Pero es importantísimo que la gente siga lavándose las manos, que no se toque el rostro, la cara, para que podamos crear la inmunidad comunitaria hasta que más personas se vacunen. Pero por ahorita no hay que bajar la guardia.
Thank you, Peter, for the questions. Jennifer, do we have somebody else?
Yes, Rocio Hernandez, please unmute yourself.
Hi, can you hear me?
Yes, we can hear you, Rosia.
Okay, I wanted to talk about and get someone to address, some people are still hesitant to get the vaccine, maybe because they don't feel like it's safe. Could you talk about what risk and side effects the county has seen so far in the people that haven't vaccinated in the county? Just address those concerns that others might still have.
So the side effects from the immunoresponse after getting the vaccine, not after not getting the vaccine, right? I thought I heard a double negative there.
Yeah.
Okay.
Yeah, after getting the vaccine.
Got you. Dr. Sonnenschein will talk about that.
So a lot of people have been talking about potential side effects of the vaccine, but what I want to emphasize is that side effects really isn't the right word, because what most people are experiencing are your body's natural immune response when you get the vaccine. So that soreness in your arm, that achiness that you feel, kind of feeling fatigued, and occasionally even getting a low-grade fever is your body's immune system responding to the vaccine and developing immunity to COVID-19. So it's a good thing when you feel those things, and that's why we know that you're going to have more of these experiences after your second dose than after your first dose, because your body has already seen it once. So that is the vast majority of what we're seeing, and that's what's been reported. And I can tell you that we have had no serious reactions recorded here in Maricopa County. We monitor this very closely, and that's just something that's very important to us. When we see any reaction, it gets reported to a national system called VAERS, and we have mostly seen what we expect to happen when the body responds. Thank you.
La pregunta es acerca si podríamos hablar, ¿qué le decimos a las personas si no se sienten seguros de ponerse la vacuna, quizás por los efectos secundarios que esta vacuna pudiera tener? Bueno, muchos hablan de quizás de los efectos secundarios, pero de acuerdo a lo que la ciencia dice, quizás no es la palabra correcta, efectos secundarios, sino más bien es que está creando su cuerpo un tipo de inmunidad cuando recibe un poco de dolor en el brazo, cuando se siente con fatiga, quizás con un poco de fiebre. Es que el cuerpo está creando la respuesta que necesita para poder protegerse. Y las reacciones que hemos visto en el condado Maricopa no han sido ningún tipo de reacciones alérgicas de ninguna forma serias. Todo tipo de reacción se tiene que reportar al sistema VAERS para ver si existe algún tipo o un efecto serio, pero a la fecha no ha existido ninguno aquí en el condado Maricopa.
Thank you, Rocio, for the questions. We have time for about 2 more questions. Jennifer, who do we have next?
Yes, Matthew Casey has another question.
Sure.
Hi, Fields. So as everything expands, as the group of essential workers expands, it's going to include undocumented workers because we know there are a large chunk of them here in Arizona and especially in Maricopa County. So my question is, how is the county preparing to vaccinate this high priority population? And has there been any collaboration or direction for working on this project, such a project with the state, from the state?
Those are good questions, Matt. I do know that the vaccine is going to be available to anybody who wants the vaccine. If people are living here in our community, they need to have the vaccine in order to keep the broader community safe. Dr. Sonnenschein can expand on that a little bit.
I think that's a really important question. And as we move forward into phase 1B, as Fields mentioned before, we have partnerships with a lot of different organizations and both government and community organizations that reach out to all of our partners so that we can reach and vaccinate everyone in the community. We also work with companies who operate what we call closed pods. Those are things that we have been doing and practicing for years and years, where the, people will vaccinate the people who work for them. So that is one way that we get to folks. And then we also work through our wide variety of partners. Thank you.
La pregunta es acerca de los trabajadores indocumentados. ¿Cómo se vacunarán y si existen algunas colaboraciones con el Estado? Bueno, cabe mencionar que todo mundo se tiene que vacunar independientemente de cuál estatus tengan. Esto es para seguridad de toda la comunidad. En la fase 1B tenemos ya varias asociaciones, organizaciones con las que estamos colaborando, tanto comunitarias como de gobierno, para poder vacunar a todas las personas independientemente de cuál sea su estatus. También tenemos compañías como puntos de distribución privados para poder lograr y hacer este tipo de asociaciones en diferentes comunidades.
Thank you, Matt, for the question. We have time for about 1 more question. So, Jennifer, do we have anybody else waiting?
Yes, Brittany Thomason, please unmute your microphone.
Hi, I'm just wondering, at this point, how long do you think it will be until the county reaches herd immunity?
That's a really good question. I wish we could predict the future. I think Dr. Sonnenschein can talk a little bit about our goals for herd immunity and what the ideal number would be, but we're a long way from that point at right now, right? She'll talk a little bit more about that. Thanks, Brittany, for the question.
So that's a great question that I think we all wish we knew the answer to. We're very fortunate to have a very effective vaccine. This vaccine with 2 doses is 95% effective, so that's really good news. That being said, we still don't know exactly what herd immunity is. The range is anywhere from 20% up to 90%, and it's probably somewhere in the middle. But as Field said, we know we're not there yet. And as we get more and more people vaccinated, we hope to see less and less spread. But until that time, people need to continue to wear their masks and socially distance, stay home when you're sick, and do everything you can not to gather in large groups.
La pregunta es, ¿cuánto tiempo se va a tardar para que podamos lograr la inmunidad comunitaria? Bueno, es una pregunta quizás del millón porque somos afortunados de que las vacunas que se han desarrollado es 95% de eficacia, tiene 95% de eficacia, pero aún no sabemos qué es exactamente el porcentaje que se necesita para crear la inmunidad comunitaria. Puede ser de 20 a 90%, sin embargo, aún no tenemos una cifra específica, por lo que es muy importante que sigamos haciendo los métodos de prevención que hemos estado haciendo, como aislarnos si estamos enfermos, quedarnos en casa, evitar los grupos o las reuniones y sobre todo usar una mascarilla.
Thanks so much for the question. That is going to be the end of our press conference this afternoon as we approach 3 o'clock. I apologize for not only the late notice this afternoon, but also the late start. Once we got here, we wanted to make sure we had those audio issues figured out. We appreciate you guys joining us, getting the word out. As I said earlier, we have had people walking up to pods thinking it was time for 1B, for them to get their vaccine. Very important that they continue to go through these steps. As we talked about some of the numbers, I think all of you know we have over 4.5 million people who live in this county, and it's going to take time to get through that many people. And as the vaccine becomes, we have a larger number of doses in our community, we'll be able to spread it out to more and more partners. And there's a lot of work to be done to make sure it's spread out to the right people and then given to the right people in the right phases. So we appreciate that. I would be remiss also, and I talked to Director Flanagan around noon today before we decided to do this today, and we felt it was very important to do this today considering how many questions those in the media as well as people in the public have. She wanted to make sure that our medical partners knew that we appreciate them, we thank them. Also, we have about 1,800 volunteers who have been volunteering at the pods or volunteering with public health in various capacities, whether it's a phone center or working at the pods or helping us with logistics. So we have a lot of people to thank and a lot of people who are making this operation work right now and making our community a safer place to be whenever it comes to COVID-19. And and the National Guard. Thank you so much for the reminder. Yes, the National Guard has played a key role as well. I think you saw some video of them in the first couple of weeks of the pods. They've been doing a great job out there, helping us administer vaccine or at least do traffic control, that sort of thing. And a lot of the police departments as well have been very involved in the traffic control operations. And if you've been out to the pods, you know those are very, very busy places when they are up and running full tilt. So thanks again for joining us today. We appreciate you as always for being here. If you have additional questions, the media members, please email us at the Joint Information Center. We'll do our best to get you the information you need. Thank you so much. Have a great day. Stay safe.